I would like to welcome you to our first session of 2023 for the LabCoP Laboratory Waste Management sub-community of practice. This is a sub-community of practice that we have dedicated to one important subject that is continuously becoming a challenge and also has always remained important to us. I would like to say we initially had a phase one of this sub-community of practice where the thrust was mostly to do with making sure that as many people as possible are aware of the challenges and the dangers that laboratory waste poses to many of us. I think we did quite a lot. We covered a lot of sessions that started getting a snapshot of what was happening in the few countries. I think a survey was sent by our colleagues from the US CDC. And then we went ahead and looked at what the WHO Blue Book for Safe Practices of Healthcare Activities and Waste Management are. And then we also featured key topics that touched on tools. Some of the tools were developed in our first phase, tools for assessing waste management for viral load. We also touched capacity assessments tools that were presented also by colleagues from the Global Fund. We also went ahead and looked at some innovative tools like the waste cost analysis framework. We had our partners from the industry coming in to let us know what their products do have in terms of hazardous components and how these could be handled. I think we had Roche, we had Abbott coming through, Hologic, and a number of colleagues that came through. I think we also had an important session on incinerators and many more. But then what we are saying now is, I think we have kind of raised awareness quite a lot. And what do we need to do to move from awareness to action? So this will be the aim of our second phase of our sub-community of practice. And we are looking forward to working with dedicated individuals, as usual, from the countries that really need to take the bull by its horns and actually move to see if we can make differences in our environments. So today's session is more of a formative session where we would like to say all the work that was done by the African Society for Laboratory Medicine in partnerships with our colleagues from the US CDC, ILB, the partners in the Integrated Diagnostic Consortium with generous support from our funders to really move where we are right now to actually make a difference in terms of action and tangible results. Colleagues, I would like to hand over to our colleague, whom most of you know from the sub-community of practice WhatsApp group, Mr. Edward Christinius, who is the president of waste whatnot experts in waste management. Many of you have worked with over the past couple of years. He is going to give us a snapshot of exactly where are we with regards to laboratory waste management and what do we intend to do. Ed will give us the angle from the viral load perspective, but then we also expand to go beyond such. Ed, over to you, and we can go.
Super, thank you, Nafi, and good day, good afternoon to everybody. Bonjour to our French colleagues. If we have anyone from our Portuguese countries, bon dia, jambo. I'm going to say Woza Thursday. I know it should be more Woza Friday, but I'm no stranger to Africa, and it is my extreme honor and pleasure to be presenting to you today. What you see on the slide, first slide, is a picture of me. This is when I started my career 41 years ago, senior year of college as a medical technologist. So I'm really honored to be in your presence. All the colleagues in the laboratories we've met over the past couple of years they're just rock stars. I'm just so enthralled and amazed to see the advances that have been made. Some of you know that I go by the name of senior citizen because people look at me and say, how long you been doing this? Or sometimes people, my colleagues in Eswatini would call me Eddie. So we have a lot to cover today. And as Anafi has indicated, this is just an intro, sort of a touch point. And I like something that Anafi had previously mentioned, discussions of, it's not just awareness, it's shifting gears into action. So the title of the presentation today is Rethinking Laboratory Waste Management. Where are we now? Oops, sorry, a little faster. So our objective today, one, we want to review the progress on what we've been doing with guanidine thiocyanate waste management. That's really what got us here. But we also want to review clinical laboratory waste management challenges and issues. Lastly, we'll discuss sort of the strategy and actions for changing gears on laboratory waste management. What has been extremely exciting for us and fortunate, I think many of you have heard the term, there is no I in team, and that is exactly the case here. My team is comprised of myself, Rick Morgan, Victor Histov, and Slobodanka Pavlovich or Boba, but we also had the wonderful team from CDC. I'm sure you know David Bressler, Monty Martin, Clement, Katrina, or Kat Seaman, and of course, just again, the rock stars, the great team that we've been working with all at ASLM, Collins, Anafi, Beatrice, Pascal, and Adisu. We've really gotten to know each other, and it's really been really great for us. I want to really highlight something. I have been involved with healthcare waste management for over 33 years. Yes, I started my career in a microbiology lab. I worked in infection control. I've been blessed to travel to over 60 countries, many of them in Africa. So I've seen what you've been working with. And I think it's really important for us to understand some things in the context of working in the laboratories. Keep this in mind. This is really important. You work with all types of potentially infectious materials on purpose. We work with large quantities of potentially infectious material on purpose. And in some cases, and I am a little biased, partial to microbiology because that's where I really cut my teeth, as the saying goes, we grow things on purpose in large quantities. So it's important that we manage these biological and chemical hazards. We have a duty. We have a duty of care to protect our fellow workers. That's all the workers, not just the people working at the bench, but it is the porters and anyone else that's involved, transportation, the public, and the environment from these potentially hazardous materials. We really don't want to see our waste streams ending up in a dump like this, okay? This is not appropriate. We know there are challenges to these. We're not gonna fix this in a day. We're not gonna fix this in a year, but if we are aware of it, we can really minimize the impact to, as I said, our coworkers, the public, and the environment. So how did we come here today? And really, as I said, we're going to focus on two things: dealing with the waste from viral load labs. And it really started off in a conversation in 2017 with Thomas Stevens from Zambia on, can you help us with GTC waste? I had no idea. What are you talking about, GTC? And lo and behold, the pictures that you see in front of you, those are containers of guanidine thiocyanate that's come off of our effluent that contains guanidine thiocyanate. I want you to make note of something on the slide. Notice the biohazard symbol. This is something that is a current theme. There's some improvisation of when we don't have enough of something, let's figure out how to stretch it out. Let's try to do something different. That's a biohazard symbol that has been cut in half. I think all of us know what that symbol looks like. So the fact that part of it is on one container and part is another tells us that there's an issue here. The challenge really with guanidine thiocyanate has been the fact that if you add bleach or anything acidic to it, it will generate hydrogen cyanide gas. And that has been a common concern. As a matter of fact, since the development of PCRs for 30 years. However, this is the only article in which you can actually see some data on concentrations. We are fortunate to date. We have researched this extensively. We have not found any actual deaths or injuries. That's not to say something hasn't happened or there have been some close calls, But this is an excellent article. I posted a link here. This is an open access article, so you can actually go back and look at what are the risks and the challenges here. So we started off with, how do we get rid of this liquid? And in fact, we were contracted by ASLM and working with CDC with these 9 countries. We've met people in all of these countries, fantastic group. We did a number of activities, which eventually led to developing a guidance document with various disposal options. The challenges that we really have is that, unlike in high income countries where you can actually pick up a phone and contact someone that will come collect your waste and take it away. Well, it actually doesn't go away, it is treated. But some of these treatment methods are pretty high tech. And unfortunately, we're lacking some of those in the countries that we're working with and in your particular institutions. So, we started looking at this as a little bit of, well, it wasn't a puzzle at first, but it became a puzzle because, as we said, we've got this liquid waste stream. Okay, but hang on, there was a question about cartridges. Okay, so now we needed to learn about these cartridges. And there's a lot of cartridges. Not all of them have guanidine thiocyanate, but nonetheless, these are potentially infectious. You have your specimen tubes, whether what the specimen arrives at, dry blood spots, or what you're transferring. Okay, here's something else that's within this viral load waste stream. And of course, being interested and really my heart is in the laboratory, we'd go to other laboratories. And some of you might know this, this is a Kirby Bauer plate, antimicrobial susceptibility discs. And now we have issues with AMR. And antimicrobial resistance isn't a new topic. It's been going on for decades. I remember it very well in 1986. And here we are today, still dealing with this. Then we are doing some training. And here's this container that, well, this isn't GTC waste. It doesn't look like the container. Oh, this is from a hematology analyzer, like a culture counter. And so why are we dealing with this waste? And how do you pour it down? And how do you get rid of it? And I was like, oh, we pour it down the drain. Similar to what's going on with GTC waste. And then we start looking at, well, where does all these materials go? Not just the containers, but the rest of this. And so we've stumbled across various ways of storing waste or at treatment facilities. In fact, in the middle here, you can see there's a dried blood spot, okay? And you have, even in the storage areas, situations of improper disposal or storage, containers breaking open. In many cases, it's been fantastic, the amount of testing that's been done to improve the lives of people, but it's also increased the amount of waste. And our treatment systems really haven't kept up with that. And this is a recurring theme as well. We saw many pieces of equipment used to destroy waste. Unfortunately, no electricity or no fuel, or the burner is damaged. And in fact, this little box of matches was by this incinerator. Impeccably clean around the plant, but in fact, this was just a metal box used to burn waste, and it was using these, excuse me, matches to light the waste. So what we realized is, I think you've all heard about the viral load cascade. Well, there's actually a waste cascade coming from HIV viral load EID programs. And as I just pointed out with those pictures, this diagram clearly shows you from the point where you are collecting the samples, there's waste. You've got waste in the laboratory, and you have a lot of different types of waste streams. Keep in mind, there's actually clean materials that aren't infectious. And then there are sharps. And of course, we've got liquid waste. Yet the most interesting part about the liquid waste, and we'll talk about some of the options we came up with, was the recurrent recommendation for incineration, high temperature incineration. And our question immediately was, how do you incinerate a non-flammable liquid? We really came up, and this is my colleague, Victor Histov, really, I credit him with talking about and constantly talking about, we need to take a holistic approach to clinical lab waste management. And that's what we've been approaching. Victor's our data guru. Some of the countries that are on board on our project here definitely know Victor, has been reaching out to them. Remember, you cannot manage what you have not measured. You think about your viral load testing. You have to get data to go back and treat patients. Well, we have to do the same thing here related to, well, what's the volume of waste that we're dealing with? Because that might give us some ideas of, do we have to do something on a small scale, or something on a grand scale, or a mixture of both. And Victor, in this case, you can see the number of tests being performed as well as the volume of liquids. What we found interesting is that with new technology being introduced by some of the vendors of platforms, volumes of waste have gone down. Conversely, we're seeing that sometimes the concentration of GTC has gone up. But again, this is an evolving process. The more challenging part, and great products that are out there, the point of care facilities. I think many of you actually know it's not just a cartridge that could be used for Ebola, or I'm sorry, can somebody, Anafi, can you mute? Who's ever, I have no control on that. The
Ed, can you unmute and go ahead?
Thank you. Yep, thank you. So I think everybody knows point of care testing. We have the issues of a lot of different cartridges. In fact, they're not just for HIV. That COVID has actually, in some cases, I think all of you know, overtaken some of the testing challenges and issues. Wonderful to be done at the point of care, but this becomes another issue on how do we deal with this. So quite interesting to see the number of facilities that are out there. So these are the tasks that we've actually completed. We actually, in fact, this is our guidance document that we've been sharing with the 9 countries. You will eventually have access to this. We are still waiting for some feedback because this is during training, we provided this as well as practical hands-on training. And the real objective here was to, again, come up with some treatment and disposal methods. And in this guidance document, these are some of the things that we provided work instructions. And we know that many countries were or are still discharging to sewer, and we want to stop that. But what are the alternatives? And just quickly going through the list here, one of the original items was actually taking small amounts of liquids in a plastic bottle, putting them into an incinerator. This is a bit of a trial and error. I mean, in fact, there really isn't much data to show. So what happens if you put this liquid in there? What is there anything in the ash? Is there anything in the emission? So there's some testing that we've done, and I'll talk about that shortly. Cartridge waste, yes, you can incinerate this material. There are also pyrolysis units. There are also, there's some testing that's been done with an integrated shredder autoclave. It didn't destroy the guanidine thiocyanate, but it actually reduced the concentration in the effluent significantly. We've seen mixing and drying the waste with sawdust, and which can be incinerated. Challenge there is finding the right mixture consistency of the liquid. And again, we have a couple of the countries that are doing this. Ground charcoal or charcoal dust. And I'll mention that in the next slide because it's really fascinating about how we came across to that. Transporting a liquid to cement kilns. In fact, on this photograph, on this slide here, this is actually some waste that was taken to a cement kiln in Chilanga in Zambia, where we were doing some trials and testing. In fact, Lafarge is interested in accepting this waste, but you definitely have to meet with them. We have to meet with any cement kiln that would be interested and educate them so they understand what is it that you are willing to take to them. Lafarge actually has a program, GeoCycle, where they accept a lot of different waste streams. So that's certainly an option and a line of communication. We actually mentioned here 20 liters going to the cement kiln. Personally, the reason for that is that's the maximum size container that fits in the RAM feed. So there might be different quantities, and we actually spoke with Lafarge in Nigeria on this, and it was interesting. They talked about slightly different volumes. Mixing with cement, inactivation or inertization, I should say, is a common practice. It's a little bit challenging. There's some photographs. There's a photograph at the top that shows some of this. One of the things, and we'll show you this shortly, precipitation and titration method. We've also been experimenting with activated charcoal. You'll hear a little bit about ozone, or I should say hydrogen peroxide from Uganda, liquid injection into incinerators. And then we've actually started a project with the University of Cape Town on bioremediation. Transboundary movement isn't really a treatment method, but it's something that some countries have utilized. So in the case of sawdust, this is a low cost approach. And basically, if you have access to sawdust, now we know most countries, not all countries would, and there may even be some seasonal variation. This is from our colleagues in Nigeria. Charcoal dust, because initially there was some discussion about using biochar or charcoal, but you'd be paying for this. And we know that cost is a significant barrier to really moving some of these things forward. Well, in fact, this was one facility in Chaz in Lusaka, Zambia. They found at the local market charcoal dust that no one wanted to use. They were discarding it. So here's a 120 liter container of charcoal dust. They actually have placed it a container in their laboratory. They mix small quantities with the effluent, and they manage, this is an incinerator at the rear of the laboratory. In fact, the lab techs operate the incinerator. It was well run from beginning to end. This was definitely a great find for us and something to consider. What we've also done is looked at what's called a precipitation protocol. And this is a novel method for this project. Precipitation has been done before for thiocyanate, but not for guanidine thiocyanate. And this basically requires using copper sulfate, sodium thiosulfate, and you end up with a cuprous thiocyanate, which is a material that you can also send to a cement kiln. You can mix with sawdust or charcoal dust or some material to incinerate it. You can mix it with cement. Interesting enough, cuprous thiocyanate is added to paint as an anti-fouling agent. So we've even added this to paint while it's still in its liquid form. Now, one of our challenges has been, what is the concentration in the GTC itself? So we've actually developed and we've shared a protocol with some countries relative to the titration protocol or titration procedure. Basically, what does this give you? If you know what the concentration of your GTC is, and you can enter in the amount of liquid that you want to dispose of, this then calculates in this precipitation helper the amount of copper sulfate and sodium thiosulfate. This is still a bit of a work in progress because we were dealing basically with small quantities of liquid, but if we had larger ones, there might be some interest in producing, or I should say purchasing, larger quantities of copper sulfate, because that would reduce your costs. If we then just move on to things that are in progress, we actually have done some things with activated charcoal, activated carbon. We have seen a slight reduction in guanidine thiocyanate, but not completely. I'll show you a picture shortly from a new system that's been installed in Kampala at CPHL using hydrogen peroxide. We have spoken with incinerator vendors. There is liquid injection into incinerators, although that is something that you have to have a conversation with the vendor specifically. You're basically spraying, misting in a liquid, and this will volatilize much better. Lastly, the University of Cape Town is undertaking a bioremediation project. Basically, in fact, this is already being done in some of the mining industries. In fact, that you can take thiobacillus that will basically break down the thiocyanate. And in fact, what we're trying to determine is what is the concentration that will be most effective for the thiobacillus to work on the thiocyanate. So things to be coming out in the near future. This, in fact, what we're really excited about this process in Uganda, which is a lot different from the other facilities, is that this is actually a wastewater treatment device. This is a photo courtesy of engineer Abdul Mutaka. This is still just getting into the commissioning phase, but this is a device in which wastewater from these labs that has GTC waste will go through this process. Stay tuned. We will have some more information from this once they have commissioned it, to get some feedback from them as well. As we mentioned, there is incineration of the cartridge waste. They're a little bit different beast. You know, these cartridges themselves, liquid goes in, but liquid does not come out. And in fact, one of the experiments we did is we did put these into a pyrolytic chamber. And in fact, we measured the ash. Our chemist, Rick Morgan, did the analysis, and we didn't find any guanidine thiocyanate. We're now waiting for another series of tests to see, all right, is there anything in the air emissions? And there are some filter particles, filtration media that we're going to be testing. I also mentioned the shredder autoclave system. This is a device that actually we put cartridges in. These are unused cartridges, so the highest concentration of guanidine thiocyanate. We captured the shredded material. Remember, here's something interesting. There's a lot of interest globally at doing something with these treated waste streams other than burying them or incinerating them. The guanidine thiocyanate concentration in this was reduced by dilution. So this is something that still elicits some GTC, but the concentration in the effluent from this particular equipment was extremely low. I have to give kudos to all the colleagues in the countries that we visited. They're just fantastic, from Ethiopia, Malawi, Zimbabwe, Uganda, Kenya. We did virtual training in Eswatini and Mozambique and Nigeria. And of course, we actually started this project really initially in Zambia. So again, we couldn't have asked for dealing with better people in all the countries. Just fantastic. So this is a quick overview of where all these countries are. They've all done the precipitation procedure. They're now in the process of evaluating what they're going to do. Ethiopia appears to be looking at precipitation. Malawi has looked at sawdust, encapsulation, and precipitation. Nigeria in Abuja, they are using sawdust. You just saw the Uganda, the wastewater treatment system. Zambia has formed an assessment team and will be looking at the different options that are out there this coming year. And as I said, the incineration charcoal dust is something that the CHAZ lab is using, and it's something that could be an interesting model as well. If we move on to, the question on other waste management practices. So we all know there's a wide range of platforms that are out there, and these are not just dedicated to viral loads. Some of these are from a microbiology lab, some of them are from hematology. So there's a lot of liquid, there's a lot of samples, there's a lot of products, tips, etc. So when we're visiting these facilities, we started to take a look at, well, what is going on related to practices? And it's clear there is signage everywhere. Some of it's better, some of it's not as good, but it's there, it's out there. I think the important thing related to this information is it periodically has to be updated, because it's like a stop sign at a corner. Many of you might stop, but that corner, that intersection, you may just roll through it. So, well, I know there's a stop sign, but I don't worry about it. These are things, there's a constant reminder to people that this is an important thing related to waste management. So updating these periodically, I think, is something that we would be recommending. Segregation practices. Are containers being used? Absolutely. All different types of containers, all different types of bags. It's interesting to see the labeling systems. Again, sometimes you have to dig a little bit deeper. Here are two containers that are both red bags. Well, one is labeled non-infectious and the other one is infectious. And this was a supply issue. The laboratory actually informed us that, yes, everybody knows what's going on in this facility, because actually all the waste went to the same facility to be incinerated and disposed of. And again, let's not forget about the other liquid waste streams that are out there, and of course, sharps that we're dealing with. Now, what really struck us in the work that we've been doing the past couple of years, and I put up this yin and yang symbol. And as you know, there's yin and yang is basically providing two perspectives. It could be a positive and negative, good and bad. And what amazed us was, in fact, we're dealing with 21st century technology, 21st century techs. Sometimes the waste management just hasn't kept up with that. And there's some curious photographs, things that we see. And I think this was a great example. You see an educational poster on the left side, very clear. What are black bags for? What are yellow bags for? Red bags, sharps containers. And then on the right side, this is one of our training sessions. There is this autoclave bag over a window. And we started thinking, oh, is this for privacy, security? It won't do much for privacy because it's kind of open near the bottom. Is it a shade? Is it some sort of improvised biohazard symbol? And this is, okay, if this is one bag, you think, well, it's only one bag. But these types of usage are going over and over. So we want to go back and really understand that improvisation is okay. Remember, you're going to improvise, but improvisation should not be the norm, okay? We really need to make sure, as you have standards and quality standards, which we're going to talk about just shortly here, the same thing has to apply to the waste management side. Where things really were disconcerting is the storage of this waste stream. And yes, some facilities have containers and bins, but majority of the places of what we're seeing, really, it just was poor practices across the board. And in some cases, we're dealing with large volumes of materials. I think part of this, as we mentioned to you before, this is a challenge related to more testing being conducted, more samples being processed, yet waste streams or waste treatment systems not keeping up. Now, that's not the case in all locations, but also something that struck us. And we came up, we're looking at this treatment, incineration versus incineration. Ladies and gentlemen, these three photographs on the top, this is not incineration, this is burning, okay? Incineration is a very controlled combustion process. What you see on the right side here, this is actually in Namibia, city of Windhoek centralized treatment plant with air pollution control. This is a system that's addressing not only environmental issues, but also occupational health and safety issues. The fact that this has a ram feed system. You see below here as well, this is another unit recently installed, has a ram feed system. This is going during commissioning. Notice though, remember, when you look at these systems, you definitely have to consider the handling of waste, the introduction of materials. And this is a case of there's an occupational hazard here. As waste that is introduced into this incinerator and the door is coming down, flames are shooting out. This is not acceptable. And one of the key things that we want to consider, and we'll be talking about this in the next session, is really understanding the selection process of technologies. And some of the countries have already done this. Zambia has gone through this process a little bit, but you know, we really come to, there's been just such great success with HIV viral load programs for the past 20 years. It's just amazing. But why do we continue to be challenged in waste management? You know, look at the platforms that you see up above. Just fantastic. I mean, this is the same equipment that is in cities of New York and Paris, and the techs that are running these can work in those. But then things fall apart, whether it's the waste storage, non-secure areas. So one of the things that we've done, and this slide really puts it all together. I don't know if you're familiar with SBAR, situation, background, assessment, and recommendation. This is actually something that's been used in healthcare to quickly assess patients. And it's actually been used in other applications, in the military, in the airlines. It really gives us a quick assessment, overview of what's going on and what is the direction that we need to go. It's a communication tool. So we know what's our situation. Practices within healthcare waste management practices and facilities, they're satisfactory, but proper treatment remains substandard. Historically, what's the background? Most of this waste stream has been managed haphazard. I've been to 60 countries. I can tell you this has been a recurring theme, where crude burning being the most common method of treatment. Although we're making progress, we are making progress. Assessment here is that the advances in laboratory medicine have contributed to this increase in the amount of waste being generated. It is great for the patients because we're getting results back to them faster. But at the same time, we have challenges with the waste stream. And the incinerators still become the most common treatment methods. And the question becomes now, the quality and the range of this is a big issue. Their operation, their maintenance varies greatly, contributing to an overall substandard practice. And we know that there's something similar to this with some of the equipment and some of the platforms, because we've chatted with some other colleagues in laboratories, and this mirrors it. If you don't maintain it, if you don't manage it, you're going to have issues with it. So our recommendation is we really need to establish these minimum standards for clinical waste management by identifying key people, the stakeholders, to ensure that they understand what the issues are, to look at the products and practices, and use and implement it and what is required to maintain the minimum standards. We'd like to get some locations together to develop, to basically become case studies. So we'll see how this evolves. But you know, what was fascinating to us is when you look at implementing the HIV viral load testing programs, they've been done in phases. This is extremely, extremely well documented, okay? There's plenty of data in the literature. In fact, we just substituted the implementation of viral load and phased in implementation of laboratory waste management. All the things here that you see, phase 1, 2, and 3 can all apply. Okay, maybe not specimen and product selection, but all these other items are definitely there. You do have standards out there. In fact, you may have listened in last week when Melissa Meeks was talking about the introduction of the new medical laboratory standard, ISO 15189. And in fact, she puts up this one slide on lab management, the system. And in fact, there's quality management. And what's right above it? Biosafety and waste management. And I know that there's been a big push for biosafety and biosecurity now in many of the countries coming from the Africa CDC. I've been part of the APSA since 1994, so I understand the importance of biosafety, but biosecurity has taken even on a new role. And we saw this in many countries, but interesting, you could get into the facility, or you had to go through biosecurity to get into the facility, but the waste itself was handled very poorly, which was a biosecurity issue. You notice Melissa also lists a number of other standards here, risk management, laboratory safety practices. In fact, she misses one. This is ISO standard 35001. This is biorisk management for laboratories and other related organizations. These documents don't go into, they're not extremely prescriptive, but they provide you guidance of what you need to be doing. And we know that the various PEPFAR programs, the COPS, ROPS that have been going on, they also talk about biosafety and waste management. So again, the awareness is there, but as Nafi has talked about, we've got to shift gears. We've got to really start implementing things. And just like viral load programs, a sustainable waste management program it's complex. It's more than just saying, well, just throw it away. There is no away, folks. There's no place called away, all right? In fact, what we did, we distilled this whole sustainable waste management down to a couple of things. Commitment. You need to be committed to this. And you have to have awareness. You need to be educated, because that's going to help you drive your strategy. And then you could look at policy, and you have to have ownership in this. And again, we have seen a number of cases in various countries in the African continent and in other parts of the world, in fact, as well, in the Caribbean and even in Southeast Asia, where there is commitment, there is leadership that's really interested in this. In fact, here is a good example. When I was doing training in Zimbabwe, I also had the opportunity to meet with the director of this Luisa Gwati Mission Hospital in Mutoko, Zimbabwe. They, in fact, they had an incinerator that really was not functioning right. And fortunate for them, it's an Italian dentist who's been actually living in Zimbabwe, I think he said, for 15 years. So he spoke with colleagues, and they were able to get a non-burn technology, which treats waste, destroys waste, but they wanted to go a step further. They didn't want to put this just into a dump or burn it. They actually mixed it. They devised a way of mixing it with concrete. Now they have these blocks. They created concrete pads. So this is something, this is not new thinking, but it's actually being applied. And this is really exciting to see this. So one of the things that we will be doing is finding those locations in your countries and being able to go and visit them and see them. Because in most cases, and I've seen this from West Africa to the southern part of Africa to northern Africa, there's still a lot of incineration being utilized, and there are alternatives, and they're out there. They really are. There's a fair number of them. So what is really the strategy? Okay, this raising this awareness even further, looking at regulatory developments, assisting with practical solutions, this capacity building. This really, we really need to have you learn to ride the bike and ride it well. There has to be delivery of trainings, but I think one thing we're realizing, it's important to have some sort of waste management advisory board. And in fact,
Ed,
seen this
sorry,
yeah.
Sorry to jump in. We are almost close to the end, so we can take a few questions.
I'm almost done. I got 2 more slides. So basically, let me actually jump on to preview of the next session. And what we're trying to do is this. These are the things we want to consider. 4 Ps: people, product, practices, and price. These are all the components that we have to be considering in healthcare waste management. And some countries already started to do this. As I said, adjudication committees in Namibia, in Zambia, in South Africa, looking at equipment. And these are things, we need to have these case studies. So we're going to be talking about this. Here's a case in point: integrators and biological indicators for autoclaves. Most of the facilities we visited were only using autoclave tape. That is not in compliance with the ISO standard. You really need to be using, even at a minimum, integrators. So we have provided them to a few countries to have them use integrators, but here's a component of monitoring and periodic challenge. And with that, thank you to ASLM, to CDC, and all of our laboratory colleagues.
Thank you very much, Ed, for the wonderful presentation and sharing the experiences. They say a picture always tells 1,000 words. I guess that's why your presentation took quite a while. So thank you very much. I can see the chat is buzzing with a lot of questions. We will try to address a number of them as they are coming through. As you have seen, Ed, I think there are quite a lot of options that you gave that are there, and many of the countries are interested. So I pick all of those questions that said, how do we get in here? As long as we are one of the LabCoP countries, definitely there is already an option to do so. Many of you are already making those work plans. I think this is a good step to use and include these and see how we can move together. We are not only limiting to LabCoP countries. I think those countries that are interested, we can always reach out and move ahead. So going into the questions, Ed, there are many options that you have mentioned, from incineration, you mentioned charcoal dust, sawdust, pyrolysis. I'm picking this question from, I think it's Jamia, and also the precipitation. How feasible are these? It seems for many of us, incineration is what we have. And I remember you said incineration versus incineration.
Yes, listen, here's the challenge. We looked at what was locally available. Again, you are not in a position, with the exception of reaching out. If you have a cement kiln, example, Eswatini doesn't have, nor does Lesotho have any cement kilns. So they can't pick up the phone and say, Lafarge, can you come and pick up our materials? Because you can call them, they'll say, okay, here's the price, here's the cost. So we had to look at low budget, no budget. And in fact, when you start looking at these, that's clearly something is what can you afford to do? And so sawdust itself, example, talking with Orji and Abuja, said, I gave people some money for the sawdust, they were just throwing it away. So right now, we need to be you have to be a little bit creative to look at what that option works out there. Nafi, there's no silver bullet here with any of these procedures. They definitely don't move you away from pouring liquid down the drain. So you want to, again, in our work instructions, at least with these 9 countries we've been working with, we've talked to them about the pros and cons of each of them. So they will look at them and assess, they'll determine what works best for them. Malawi said sawdust is what they like the best. Ethiopia, they like the precipitation. So it's important to do some cost calculations, look at the labor involved in this, look at the volumes. I mean, seriously, if you say like Uganda, large centralized area, those procedures would not have made sense to them at all. None of them, other than the wastewater treatment system. So they made the commitment to do that. So that's, again, I don't have any, this is the best way. Let's talk, this is what we've been doing with each country. We've given them a tool, and this is a multi-criteria matrix that Victor developed that we have trained people on. Now it's up to them to do that. And we're happy to discuss that with any country that would want to go through that. But there is no one solution that's going to work perfectly.
Perfect. Thanks a lot. So it seems there is, we can build on that to guide exactly. This is always going to be context specific, obviously determined by what works best in the countries. Moving on to the questions that are also coming through. I think there was one who mentioned about where do we get the precipitation protocol. Maybe just a quick response to that.
Yes. So right now, the protocol has been shared with 9 countries, and we're just waiting for some feedback. Well, the precipitation has been done by all the 9 countries. We've gone a step further, and as you notice, we mentioned a titration procedure. So there are a couple of countries trying the titration procedure because that does involve procuring chemicals. And so we're waiting to get some information back on what did it cost you to get the silver nitrate, the nitric acid, etc. Eventually, and we're hoping to do this probably in the next couple of months, once we've gotten the feedback and we've made edits to those procedures, we can share this with other countries via the ASLM Academy. We'd be posting it up there. So I would say stay tuned. In the next, I don't want to say in the next 2 weeks, it'll be available, but it will be available. I'm going to probably say the first quarter of 2023, because we are getting feedback from many of the countries. Okay. Everybody's came back late from holiday.
Thank you, Ed. Maybe I'm also going to add to say, like we're saying, today is a formative presentation. What we are hoping is, as we have reached out to some of you, is to really get dedicated teams per each country that are willing to walk this journey with us. And that means really charting a way forward and maybe a work plan for each of the countries and see where we reach. One of the key challenges that has been pointed out in the chat here, I think I want to pick from Aloysius, is the issue of resources. And I'm going to equate this to that slide where you say incineration and incineration. Some of these incinerators are actually just burners. But I would like to also call upon Monte here, because Aloysius also sort of flagged out CDC and other funders as well that are there to say we know what we need sometimes. Sometimes we know we need incinerators or even other things, but the issue is the funding. So Aloysius says it's the issue of policies and the issues of funding. So what are the CDC, WHO, governments, and other funders doing to intervene? Monte, you want to chip in on this?
Thank you so much, Anafi. Yes, I'll say a few words in the interest of time. So how we address the policies is really it's based on the government. What we're doing as part of this project is to assess the situation, provide the awareness, the tools, the techniques, the strategies that Ed eloquently outlined today, and then recommend specific standards such as the guidance that we're trying to develop, other standards, international standards like 15190, the safety standards that governments can utilize to make sure that they govern proper waste management practices. The funding piece with Global Fund, I will let them speak on that, but we're utilizing our funds to provide this service for waste management. And like Ed mentioned, a holistic approach, not just focusing on just HIV, but this is COVID waste. I mean, all other types of diseases as well. So that's how we address it on our end as well. Thank you, Nafi.
Thank you, Monte, for that. And I think moving on, Ed mentioned that I think waste management is always linked to quality management. We had a session last week where we introduced the new ISO 5189 standard. And I would like to connect that with what Eve is saying, and Eve is from the accreditation body, SADCAS, where she says regulation is obviously being overtaken by events and technology. And she thinks greater awareness to enable practitioners to identify appropriate solutions is important. Now, as she has kind of challenged, is there, oh, that thing has disappeared on my screen. But she's saying, is there a guidance that maybe ASLM and partners can really point out to with regards to waste management, a practical way of approaching this? And yeah, I think it's also to do with what Ed has mentioned. I think that maybe decision matrix. Ed, would you want to speak to that?
Yes, you know what, Anafi, we've worked in a number of countries. There are steps that one can follow that we can easily outline. We saw it in Namibia with the city of Windhoek. We've seen it in Jamaica, saw it in St. Lucia. So the steps are there, okay? And it does require, in fact, it's been done in a number of countries. I remember doing something in Uganda as well. The steps are there, the awareness is there. It's having someone leading this. Remember, we talked about commitment. So again, in the interest of time, we have some of this material together. We can share it. because there are case studies on those adjudications and going through that process, all the steps. Matter of fact, sometimes it's referred to as an integrated waste management plan, okay, which we've done. So I can share that. Definitely that's an approach that can be taken. I think that we can collaborate with ASLM on this to get it out to our members.
Great, thanks. So one of the challenges in many of our endeavors is when we leave out certain stakeholders in anything that we do. Normally we hit a roadblock. And I want to pick this from Tura Gaugalo, who says it would be nice to engage stakeholders like the environmental management authorities for advocacy purposes. Who do you think are critical in waste management for laboratory services?
Well, certainly in each of the countries we've been dealing with, and I'll refer to Zambia as a great example where we did deal with Zima, where they were sitting at the table. In fact, I think of all the stakeholder groups that we were involved with, the Zambia group had something like 80 people, a bit big to manage, yet you want to bring everybody to the table. So it can be anywhere from the vendors, having, again, say a Roche and an Abbott there, the local distributors, the treatment technology vendors, the local lab supplies. It really, as I said, Zambia is had quite a large and diverse group. On the regulatory side, giving them, well, donors need to be part of this as well, because we know at times donors are in fact providing supplies that might not be appropriate or well-intended. And here's the case in point. So many places were using autoclave bags that we visited, yet nothing was being autoclaved. That's an extremely expensive product that could be, you could utilize regular bags. So bringing them to the table and truly understanding the needs. And I'm pretty sure a majority of the donors don't really understand there are things out there other than incineration. We're not against incineration. There are products that have to be disposed of. That's the best technology. Yet, and we know that there are a number of non-burn technologies scattered throughout Africa. I mean, they really are out there. I don't think we really have done a good job of making you aware of what is available.
Great, thanks. I know we have gone beyond time. Obviously, we started a little bit late. But as we have said, this is a formative session to exciting weeks and months ahead. What we are calling for is for dedicated country teams that are willing to work with us, really sit down, use this bar we look at the situation that is on the ground. We also do the assessments. What are the recommendations of moving forward? And can we outline those things that we can immediately do in the immediate future, those in the medium term and those in the long term? And maybe we need to work out together. I think a lot of funding issues were mentioned. What are the opportunities that we can immediately identify, all of us? And I think this is what we do within the LabCoP. We work with you to try and identify many of these. And I'm hoping that the future sessions that are coming are going to be based on what the teams are actually doing. Ed today just showed a few key highlights of what is happening, but I'm sure many of us would like to know exactly when we say pyrolysis, when we say use of sawdust, charcoal, cement kilns, how exactly is this happening? And we are hoping that I think many of our dedicated members that are here will be the ones really demonstrating to us how this has been happening in the different settings. And I'm hoping that maybe after some time we can look back and actually have some tangible results that we can look at. This is the work that we are doing within the LabCoP, and we will obviously continue featuring some of those that are here and moving forward. Ed, I would like to give you 1 minute to, a few seconds to a minute to try and give us a few closing remarks.
This is going to take time, folks, but we are headed in the right direction. You know that I'm enthusiastic. You know that I'm in love with this field that we're working in. Start off with small goals. You're not going to conquer everything in a week. Start small, communicate. That's what the S bar, that's what we liked about the S bar. Very simple, communicate, work together as a team. Actually reach out to your other colleagues as well, because they may have some thoughts and ideas. That's where I think we are right now. This was a little bit of a wake-up call again, rejuvenation. So let's continue the travels as we did with our GTC waste training, which we started, a few years ago. Thank you, Nafi.
Great. Thank you, Ed. And on that note, colleagues, we will share the recording and the slides. I can see a lot of those requests in the chat. Everybody who registered for this session will actually receive those. We look forward to working with you and exciting days ahead. Of course, it's a long journey, but we need to work together.
Mm-hmm.
Thank
Yes,
you, and
exactly.
have a good afternoon and good evening for those that are in the Far East, and good morning to people like Ed.
Great. Thank you, everyone. Merci.